Hello, everyone. It's Dr. Luke Deckard with Back 9 PT and Performance. Again, kind of talking through the body swing connection today. And our focus is now going to be on the lower back in different injury inducing swing mechanics that can be causing that low back pain, as well as some of the potential physical limitations that could be causing it. Obviously, that's why we're calling it the body swing connection. Is there physical limitation that's leading to this swing characteristic, or is it just some of it is just a lack of knowledge on the correct form to utilize or understanding how to do it? So that's kind of what we're going to start with today. So low back pain is the number one cause of pain, and honestly, like people on like amateurs and professionals being out of playing for a season. So what we want to do is to understand why, to be able to look at our own swing and say, ooh, am I doing any of those things that could lead to pain? Because sometimes it's a ticking time bomb. Even if you're not having pain now, you're going to in the future. And we can tell based on what you're doing. So then what we want to do is then think about some tests or movements you can try to see if you are limited. Maybe you need to, be seen by a physical therapist or work with a trainer to try to address those limitations yourself. So the highest predictor of low back pain in the golf swing is a characteristic we have labeled reverse spine angle. So, in a typical swing, when I'm at the top, I'm kind of loaded back here, and you'll notice I'm like tilted away from the target, right? So, in reverse spine angle, what happens is the player gets back here, so now my spine is actually pointed towards the target. So, with that movement, I can actually feel at the top when I go into that a lot of stress into my left lower back. But what we actually see the most common pain here is in that right lower back, and it's because of the compressive forces when we're coming out of that position. So that just repeated excess stress to the facet joints of that lower back will generally cause pain. And that's where we can even see like the radiculopathies where you get pain down the leg, or it can also stay just localized. It can be either, but that's the number one characteristic we see. The second one is actually something we can even notice in your setup posture. And this one is called S posture. So what I want you to look at here is if, I'm setting up here to hit this iron, what I'm looking for my players is if they're here. So that S is going to be if I kind of come down here and then curve out. What that is the person's pelvis is actually set in an anterior tilt. So at address, we see that versus kind of going back and forth and finding that neutral spot. That's where we want things to be. So if they're here, that's already going to put stress, because what's happening at the joints and the muscles already, or the muscles are engaged and tighter. The facets are already in this extended position, and what that actually does is limit your ability to rotate in the backswing as well. So none of those set you up to be in a good spot for the swing, and like I said, will add excessive stress to the backswing. So that one I'll see a lot, especially if you work at a desk, because generally it can be caused by tight hip flexors or lack of that hip extension. So we definitely want to take care of that, because obviously, again, that one's from the start. So it's very possible to have S posture kind of be here, but then also come into reverse spine angle. So then we have a double whammy, which can even lead to the next one, which is an excessive side bend. So this is more an impact. If you can imagine, I've already come over here. It's if I'm getting really side bent here at impact, because that, again, that's putting a ton of excessive stress on those facet joints. If you're an avid golf fan and do a lot of kind of watching for the professionals, Will Zalatoris may come right to your mind. And he actually had to have back surgery in the past couple of years due to that move. And he spent the last year rebuilding his swing to not do that. And that's one of the best players in the world. So just imagine, he is, he is practicing all the time. We have that kind of overuse component, but he also has the best rehab and strength teams around him that you as an amateur might not. So if you feel like you're getting that excessive side bend, which we'll be able to see utilizing Sportsbox AI. That's something we also need to address because, again, you're a ticking time bomb. And then lastly, what we'll see a lot is early extension. So this would be that as you come down towards the ball, your body is extending toward the ball versus sitting back and being away from it. So again, that early extension is kind of puts extra stress onto the lower back as well. So those are some of the 4 most common swing characteristics that we look for during our assessment because we know those are going to be highly correlated to low back pain. Or if you're already coming in with low back pain, we're looking to see, are you doing this, which may be some of the underlying cause. So now to bring that in and kind of connect it to the physical aspect of things is generally the physical limitations that we see a lot that lead directly to some of these movements are limitations in your hip range of motions, particularly rotation. So for reverse spine angle, some of the biggest things I'll see are limitations in the ability to rotate internally on this trail leg, as well as being able to rotate to the right in your thoracic spine. If we're limited there, usually you're going to figure out a way to try to get that extra length, and sometimes that's that side bend and backwards fill. And again, that was the number 1 cause and is really stressful to the facet joints. The second one that we kind of like limitation I'll see is for that excessive side bend. So now if we're getting here, what we actually find in this one is limited internal rotation to the hip on the left side, as well as the limited turn in that left thoracic rotation. So if those are limited, you have a higher chance of getting to that side bend because, again, maybe you can't get through the ball normally here, so you feel like you have to side bend to kind of do it. And lastly, kind of what we mentioned with S posture is that tight hip flexors or limited hip extension. That can be from sitting in a chair, commonly for work, or sometimes it's just something you're used to, have been told, stick your butt out. And by sticking your butt out, instead of just kind of hinging and going away, the player will arch their back. Again, we need to know that so that we can address it, whether it's with manual therapy, exercise, usually a combination of both, or it's just a technique thing. So take a look at your swing or send them over our way. And if that's something you have going on, or if you have low back pain and you're worried about it, sign up for an evaluation today and let's take a look at those and knock them out this year.